Welcome to G Health University. This is the training module developed to help you gain an understanding of various concepts you will encounter working out of GBON, GBACO, and the G Health enterprise as a whole. This course is part of the Basic MEDENT series. In this video, we will cover how to create a care plan. To begin the care plan, you need to be in your members chart. Go to the document div. You can create the care plan two ways, by clicking into the div itself and creating it that way, or using the plus button located on the div. We're going to create this by clicking into the div and going to the bottom and clicking on the word new. From this pop-up, you're going to take Smart Lookup off and you're going to type in the code GB care and then the word PLA. And the name of the document is GBON Care Plan 2017. The route screen will appear. On the route screen, you need to add a prescribing doctor. Prescribing doctor is abbreviated as PDR. So click on the blue link and select GBON 18. Once you have successfully added the prescribing doctor, the next thing you're going to do is hit Create from Master. This will create the form document. Right above the user's name is the button. The very top of the care plan with the member's demographic information will populate automatically off the demographic screen. If any of this information is incorrect, you would simply go to the demographic screen and update that information. Once you return to the document, it will automatically update to the new information. The next section of the care plan is the member's diagnoses. You will notice the word diagnoses followed by some diagnoses and then a bunch of checkboxes. The diagnoses on this document pull off the problem list in the chart. You will need to make sure that the member's diagnoses are listed in the problem list. If they are not or anything needs to be updated, you will need to update them in that div. This div will be covered in a separate section. The next step is checking the boxes that correspond with the correct diagnoses. So, for an example, this member has migraines. Migraines is an option. I will check that box. Same with schizophrenia and asthma. If the member has any other diagnoses, you would click the word Other and then free text something in. This member does not, so I will not use that section. As we move down the care plan, the next section is clinical and non-clinical needs. This is a list of social needs and providers at the time of this assessment. First, you will need to complete the member's providers. The first one, the PCP, or the member's primary care provider, is pulling off the demographic screen. If it is incorrect or needs to be updated, you will need to add the information on the demographic screen. It will automatically update on this screen once you have completed that. If perchance the member's PCP is not listed or you cannot find them in MEDENT, by clicking on the purple diamond, you can free text in who the member's PCP is. Once you have gotten the PCP all straightened out, move on to the member's dentist, cardiologist, etc. If the member has a dentist, check the box and click on the purple diamond and add them in. For this example, we will use Dr. Kevin Wood. Once you have added the dentist name, please check OK with spell check. Once you have completed clinical needs, you will move down to non-clinical needs. These are any social services the member might be receiving. It is important to add how much and what service are being provided. If the member is receiving food stamps, you will check the box and make sure you add the amount of food stamps the member is receiving. For this example, we will say $200. After you have completed both the clinical and non-clinical needs section, you will scroll down to the 4 questions. Has the member seen a PCP within the last year? Has the member seen a dentist within the last year? Has the member visited the ER within the last 6 months? Has the member been admitted to the hospital within the last 6 months? The next section of the care plan is activities of daily living. These are activities such as eating, grooming, bathing, dressing, or traveling. It is possible that some of our members might need assistance or total assistance in completing these daily tasks. How you would complete this section is if the member says they need total assistance with eating, you will check the corresponding box, and then off to the right you will click on the purple diamond. For this example, the member might need assistance eating from a home aide. Once completed, this is what this section should look like. The next section is PCAM, or a patient-centered assessment method. This is a tool used to assess members' social determinants of health, often explaining why patients are engaged or respond in certain ways. This section of the care plan can be completed prior to meeting with the member by the Patient Health Navigator. The Patient Health Navigator will complete the questions to the best of their abilities. If any answers need to be tweaked, they can be edited during the assessment. How you would complete this section is reading the question and selecting the correct or most correct answer from the drop-down. To access the drop-down, you're going to click on this icon. Once you have selected your answer, it will automatically populate. This is what a completed PCAM will look like. After you have completed the above section, the next section is medication adherence. You will need to go over each medication with the member to make sure that nothing has changed. Medications was covered in a previous video. One thing you must remember to do is make sure you update the medication review RX date. In order to do this, you're going to click into the medication div. There is a shortcut. The button labeled MEDS is short for medication. Click on it, and it will take you to the medication div. To update the RX review date, you're going to go down to the bottom right-hand corner and click on RX review date. This will automatically update the RX review date. Once you have done this and everything is correct, hit your back arrow and you will go back to yours. After you have gone over the medications, make sure that you review their pharmacy. If the pharmacy has changed, you will need to update that on the demographic screen. This also was covered in a previous video. Once you have completed those steps, the next question, medication reconciliation completed, you would answer yes. Next, you will complete the MMAS4 section. Read the answers to your member and mark down their answers. This is what a completed MMAS4 section looks like. The next section of the care plan is the goals, preferences, and strengths. To complete this section and address the member's social needs, you're going to answer and develop goals for the first 5 statuses. An example of this would be if the member answers no to housing, but yes to food, you're going to go across to where it says if yes, then, and develop a goal, strength, and preference. An example of this might be your member needs food. The goal can be get help in applying for food stamps. As you can see, this is an example of how you would answer the goals for the member's social needs, the 1 through 5 statuses. In this example, the member identified needing assistance with food and transportation, so goals were developed for both. Next, we will develop the member's health behavior goals. These are options 6 through 10. For this section, you only need to develop one goal. The member might say yes to more than one option, but you only have to pick one and develop a goal. An example of this might be my member says yes to exercise and diet. An example of a goal might be walk the dog 10 minutes 2 times a week. It is important to note that the goals must be clear, measurable, and doable. This goal is clear, measurable, and doable. This is an example of what a finished goals, preference, and strength section looks like. After you have gone through the list, it is important to make sure that you check that the goals will be addressed/revisited within 1 to 2 months of completion of care plan. This is the time frame. The next section that you must go over with your member is that the strengths and preferences were assessed and there were no significant barriers, and the confidence level for meeting this goal is 10 out of 10. The next section of the care plan is the other assessment section. The care plan has 3 additional documents that must be completed. It also has 2 documents that are optional. We will cover each one of these documents individually. The first document in this section we will cover is the risk and mitigation document. To create a new document, you are going to use the button located next to the box with the check mark. To create a new one, you're going to press on the end, or you can press on the button as a whole. If no document exists, it will ask you if you would wish to create a new one. Hit select. At first glance, you will notice the risk assessment and mitigation document's top almost matches the care plan. You complete this the exact same way. You check the boxes of the diagnoses that the member has. So in this one, the member has asthma and schizophrenia. Next, you move on to the crisis prevention plan. Read the top to your member, and then follow the questions. The first question is, what are the triggers that make you upset? Feel free to give the member examples: stress, income, work, lack of work. Check the boxes that the member answers to. You do the exact same thing for the question below. After you have answered the top 2 questions, your next question is, who can I call for support? Be sure in this section to gather the person's name, their relationship, and their contact info. And if the member doesn't have anybody or has a few extra spaces, feel free to suggest GBON. This is an example of what the section, who I can call for support, might look like. Note that the member has their father, their pastor, and their GBON PHN. Next, you will discuss the member's backup plan in case of an emergency. After calling 911, these are individuals who might be able to assist the member. It is important to gather the service that they are providing, who the contact is, their phone number, and when they are available. This is an example of a finished backup plan section. Please note that Pastor Bill is located in both the backup plan and the crisis prevention part above. This is perfectly all right. After you have finished the backup plan, you will move on to the natural disaster section. This is what the member should do in the event of a natural disaster or emergency. The first section is the individuals they can contact. This includes the name, the date and times the person is not available, their phone number, and what they will be assisting with. Please note that this is slightly different than the section above. This is an example of what the natural disaster section might look like. After you have put in the people they can contact, you will move down to what the member will do in the event of a natural disaster. Go over each one of these with the member. I will grab my medications. Yes. I will grab contact information for my doctor or family member. I know where the nearest emergency department is. If your member perchance does not know where the hospital is, urgent care center, or anything else listed below, feel free to give the member a handout after this has been completed. Take care of pets, find a safe place to shelter. After you have completed the natural disaster section, you will move on to plan for any other emergency situation. These are situations where the member's health or welfare might be in danger or at risk. This is, again, the member will put down individuals they will call in case of an emergency. This includes the name, phone number, and full address, and the person's relationship. This is what the plan for another emergency situation might look like. If you notice, this has their primary care physician, their GBON PHN, and then their mother. After you have completed this, all you have to do is have the members sign the document and add your signature. After you have completed the risk mitigation document, you will return to the care plan. Check the box next to the appropriate section. You will notice a blue link off to the right-hand side. By clicking on this link, it will take you to your completed document. Once that is completed, you will move on to the abuse, neglect, and exploitation document. To create this document, you do the same thing you did for the risk assessment and mitigation. Click on the blue button. If no document is found, it will ask you if you wish to create one. Click yes. Hit select up at the top. The abuse, neglect, and exploitation document is pretty straightforward. The top of the document is a word followed by a definition. Go over each one with the member and make sure that they understand them. Once you have completed that, you will move to the bottom section, where it says, if I believe I am at risk of being harmed from or experiencing abuse, neglect, and exploitation, I know that I should contact the following individuals. The member will provide you 2 individuals, one if they're at home, and the other if they're out in the community, that they can contact if they are experiencing one of the words listed above. This is what a completed abuse, neglect, and exploitation document will look like. The next thing you need to do is have the member sign off that you completed it with the member. There is also a spot for representative or guardian if the member is unable to sign. You will also need to free text your name into the white space. Once you have completed the abuse, neglect, and exploitation document, be sure to check the box over on the left. Again, the document will link over on the right-hand side. Once you have completed that document, you will move on to the PHQ2/PHQ9 document. Again, you will create the document by clicking on the blue button. Once this pop-up appears, just press OK. The PHQ2, or the Patient Health Questionnaire 2, consists of 2 questions, and the member will answer the questions depending on how they felt over the last 2 weeks. This is what a completed PHQ2 looks like. Please note that the checkbox is total. If the checkbox totals greater than 0, you need to complete a PHQ9. The PHQ9 is located here. Click on the box to create the PHQ9. When the PHQ9 is created, please press OK. The reason you must create a PHQ9 if the score is greater than a 0 on the PHQ2 is because the member has indicated that they have some form of depression. The PHQ9 will indicate how severe the depression is. The instructions for the PHQ9 are exactly the same as the PHQ2. This is an example of a completed PHQ9. After you complete the 9 questions, there will be a total that appears between the 9th and the 10th question. As you scroll down the PHQ9 too, once you have completed the PHQ9 with your member, please add your signature. Once this has been completed, you will note that at the bottom of the document, there is a PHQ9 score scale. You will be able to gauge your member's depression by comparing the total above to this scale. Once you have completed the PHQ9, it will take you back to the PHQ2. It will link in the PHQ9 exactly where the button was. You will also need to add your signature to the PHQ2 document. After you have completed the PHQ2 or 9, you will return to the care plan. Don't forget to check the box next to the corresponding document. The fall risk questionnaire and anxiety questionnaire will be covered in separate videos. The next section of the care plan is the patient education section. If your member wants to learn more about their health condition or their social concerns, you would complete this section. If the member does not, you would click Member Refuses. Both explain and how to use patient education in MedEnt will be covered in another video. After you have completed the patient education section, you will move on to the checkbox stating, by checking this box, I am verifying that the member received a copy of the care plan. You have 3 options for how the member will receive a copy: through their patient portal, in the mail, or at the time of appointment. If you give them a copy via the mail, you need to add an addendum to the bottom of the contact note once you have mailed them a copy. For this example, I will say that they received a copy at this appointment, as I am going to print and give them. The next checkbox is verifying the date that you completed this with the member, or the member signed it. You check the checkbox and then you add the date that the member signed it. I will use today's date. After you have completed those checkboxes, you will notice a section labeled For HARP Members Only HARP Requirements. Unless you are part of our HARP team, you do not need to do anything with this section. This section will be covered in a separate video. The next section of the care plan is gathering the signatures needed. You would have the member sign off and you would add a signature. If there are any legal representation or guardian present, they would sign. If there are any providers present, they would also sign. In the blue boxes, make sure you free text your name. After you have gathered the signatures, you are going to lock the signatures in place by going to the route screen. and selecting the Finalize button in the right. This will lock the signatures and you will no longer be able to edit the document.
Thank you guys for watching. Here are 3 questions you should now be able to answer. What is the document code for the care plan? What are 3 things that make an acceptable goal? What additional documents are required for the care plan? If you have any questions about the care plan, please reach out to your care manager or your corporate trainers.